Sponsored by RxCardClub.com. Get a free prescription drug card and save up to 85% on prescription drugs. RxCardClub.com. How and where do you use the Victoza pen? Key points. Victoza, liraglutide, pen is an injectable medicine used in addition to diet and exercise to treat type 2 diabetes. It is given as a subcutaneous, under the skin, injection once daily, at any time of the day, with or without food. View the expanded directions here. Victoza pen is pre-filled with the medication. You dial the pen to the dose that your doctor prescribes before you inject it. You attach a new needle yourself each time. The number of total doses in your Victoza pen will depend on your dose. The Victoza pen contains a total of 18 mg of Victoza and will deliver doses of 0.6 mg, 1.2 mg, or 1.8 mg per injection. Your doctor will prescribe the dose you need. Make sure your doctor, nurse or pharmacist shows you how to use the pen correctly before your first use. Read the instructions that come with your pen each time you get a refill in case of any changes. How do I inject Victoza? The following is an abbreviated quick guide to using your pen. You should read the full manufacturer's instructions for use each time you get a pen. If you have further questions, ask your doctor, nurse or pharmacist. Have your healthcare provider show you how to use the pen the first time or until you feel comfortable using it. Review their full instructions each time in case of any changes. Before each use, wash your hands with soap and water. Prepare your pen, see further instructions. Check your pen to be sure the liquid medicine is clear, colorless and free of particles. If not, don't use it. Wipe the rubber stopper with an alcohol swab. Attach the needle. Victoza pen should be used with Novo Nordisk disposable needles. Always use a new needle for each injection and change your injection sites. Dial the pen to the dose that the doctor prescribed for you. Insert the needle into your skin in the stomach, abdomen, thigh or upper arm. Do not inject Victoza into a muscle, intramuscularly, or vein, intravenously. Press down on the center of the dose button to inject until 0 mg lines up with the pointer. Keep the dose button pressed down and make sure that you keep the needle under the skin for a full count of 6 seconds to make sure the full dose is injected. Keep your thumb on the injection button until you remove the needle from your skin. Withdraw the needle from your injection site. If blood appears after you take the needle out of your skin, apply light pressure, but do not rub the area. Remove the needle from the pen device and dispose of it in an FDA-approved sharps container. Do not throw away loose needles and pens in your household trash. Store your pen without the needle attached. To prepare the pen each time you get a new pen. Flow check symbols. The first time you use each new pen, be sure to dial to the flow check symbol, which looks like 2 dashes. You only need to do this once with each new pen. Turn the dose selector until the flow check symbol, dash, lines up with pointer. Hold the pen with the needle pointing up. Tap the cartridge gently with your finger a few times to bring any air bubbles to the top of the cartridge. Keep the needle pointing up and press the dose button until 0 mg lines up with the pointer. Repeat steps 1 and 2, up to 6 times if needed, until a drop of Victoza appears at the needle tip. If you still do not see a drop of Victoza, use a new pen and contact Novo Nordisk at 1-877-484-2869. Related questions: how and where do you inject liraglutide? Can liraglutide be used for weight loss? What is the difference between Soliqua and Zoltify? Can I use Victoza with insulin? Yes, if prescribed by your doctor, you may give an injection of Victoza and insulin in the same body area, such as your stomach area, but not right next to each other. However, do not mix insulin and Victoza together in the same injection. What should I do if I missed my Victoza injection? If you miss a dose of Victoza, take the missed dose at the next scheduled dose. Do not take 2 doses of Victoza at the same time. Other information. Do not share your pen or needles with other people because of risk of infection. Store the pen in the refrigerator at 36°F to 46°F, 2°C to 8°C, until you use it for the first time, Then you can store it in the refrigerator or at room temperature 59°F to 86°F, 15°C to 30°C, for up to 30 days. You can use your Victoza pen for up to 30 days after you use it. If you have additional questions about your Victoza pen, call your doctor, nurse or pharmacist. You may also contact Novo Nordisk if you have additional questions about your Victoza pen. You can call a certified diabetes educator at 1-877-905-1126, Monday through Friday, 8:30 a.m. to 6 p.m. ET. These instructions do not take the place of talking with your healthcare provider about your medical condition or your treatment. Bottom line. Victoza is a pre-filled injectable pens used in addition to diet and exercise for the treatment of type 2 diabetes in patients 10 years of age and older. It also approved to reduce the risk of major adverse cardiovascular events, like heart attack, stroke or death, in adults with type 2 diabetes and heart disease. Injection sites include, into your skin in the stomach, abdomen, thigh or upper arm. Do not inject Victoza into a muscle, intramuscularly, or vein, intravenously. There are several steps to follow for your Victoza injection. Be sure your doctor, nurse or pharmacist shows you how to use the Victoza pen before your first injection. The illustrated manufacturer's instructions are found in each package of Victoza. You can follow these illustrated instructions to review the steps needed to inject Victoza. If you still have questions, call your healthcare provider. This is not all the information you need to know about Victoza for safe and effective use. Review the full Victoza information here, and discuss this information with your doctor or other healthcare provider, rxcardclub.com. Get a free prescription drug card and save up to 80% on prescription drugs.